Monkeypox is a zoonotic disease caused by the monkeypox virus. The virus is first identified in the research monkeys and was not discovered in the human until 1970. It is a vital zoonosis, meaning it can spread from the animals to human and also human to human. Human with the close physical contact with the symptomatic person could be infected. The rash, body fluid of the symptomatic patients are particularly contagious. Up to now, it's not clear whether people without the symptoms can spread the disease. The symptoms of the monkeypox are similar to the smallpox, but milder. The incubation period is usually 6 to 13 days. A few days after being infected with the monkeypox, patient may experience symptoms associated with fever, swelling, lymph nodes, back pain, and muscle pain. Severe lymph node swelling can be distinctive features of monkeypox before the rash begins. The rash usually begins within 1 to 3 days after fever. Rash tends to be concentrated in the face, palms, and sole of the feet. Can be also found on the mouth, congenitals, and eyes. Symptoms usually last for 2 to 4 weeks, and patients usually heal by their own. There is evidence that the smallpox vaccine can prevent monkeypox. However, WHO declared smallpox eradicated in 1980, the same year that Hong Kong stopped the vaccination against smallpox for children. Therefore, all Hong Kong citizens aged 42 and under are not immune to monkeypox. The U.S. Center of Disease Control and Prevention (CDC) recommends the vaccination within 4 days of exposure to the monkeypox. That may prevent the infections, and that vaccination within 4 to 40 days of the exposure may reduce symptoms. However, there's no need to be panicked now. It does not mean that monkeypox virus symptoms are more severe than the COVID-19. Actually, the number of quarantine days are related to the nature of the disease, especially the incubation period. For example, the incubation period of the monkeypox is usually 7 to 14 days and can be ranged from 5 to 21 days. On the other hand, for COVID-19, the mean incubation period is 6 days and it ranges from 2 to 17 days. That's why the quarantine timeline for the monkeypox and COVID-19 differ. Literature shows the vaccines for the smallpox is still effective against monkeypox. Therefore, although the transmission rate of the monkeypox is still low, vaccinations should be prepared once there are any cases detected in Hong Kong. Currently, there is no literature and investigation about these issues. They should have the similar risk of contacting the monkeypox as others who do not have the COVID-19. Only people who have the smallpox vaccination are likely to be protected from the monkeypox. Since the transmission rate of the monkeypox is still low, and large-scale transmission is not yet happened, therefore, there's no currently needed recommendation to buy it by yourself. The infected person is no longer infectious after the active skin lesions has recovered. So if your skin is not recovered yet, that will be contagious. There are 2 approaches to prevent the monkeypox. The first one, as we mentioned, is about the vaccination program. So actually, if you take the vaccines, you will prevent disease. And other approaches is to cut down the transmissions. So quarantine may be helpful. According to the current information, monkeypox is low possibility to be the next pandemic. First of all, because the monkeypox is a rare infection, over the past 60 years, we do not have a large-scale transmissions. So actually, now we have a low risk on that. The second reason is about the COVID-19 transmission approach of the monkeypox could be limited to direct contact. So actually, we also, the social distancing is also protect ourselves to contain the disease. So it's a small possibility to become the next pandemic according to the current information. The major long-term side effect is usually disfiguring the scar and also corneal lesions, similar to the smallpox. Other infections like the secondary bacterial infection may happen.